In India, the number of confirmed coronavirus infections has now topped 600,000, but the Indian government is striking back at critics who say it hasn't done enough to fight the pandemic. It has introduced a revamped strategy to curb the spread of the virus. DW's Manira Chowdhury brings us this report from the worst-hit city, Delhi.
A massive door-to-door survey exercise has been launched in Delhi for its entire population of about 20 million residents. The state government is aiming to record the health details of each and every household to deal with the spread of coronavirus. The move has come after weeks of scrambling for measures by both the state and the national government to avoid a major healthcare disaster in the capital city, which has now become the worst hit in the country.
Even the government is not, sure what will work out and what will not work out. So I'm a little scared, but we can't lose hope.
Earlier, we could step out a little, at least to buy essentials and groceries. But now we're worried that if we step out at all, we may get infected.
As part of its revamped strategy to handle the spread of cases, the Delhi government is taking a range of measures. They include increased testing and contact tracing, antibody testing, developing a plasma bank, and providing oximeters to COVID patients. The government simultaneously is trying to ramp up its healthcare infrastructure. The daily testing for COVID-19 has increased significantly. The state government says that it is now conducting 20,000 tests every day. Apart from plans to start rapid antigen testing, which allows for faster diagnosis of samples, regular testing camps are also being set up, especially in coronavirus hotspots known as containment zones. Sangam Vihar, one of Delhi's largest and most crowded informal settlements, has several containment zones. The new testing camps there have already started making a difference.
During the past week, testing has increased. Many positive cases are getting detected. Earlier, the testing wasn't so regular. Now it's daily.
Some 200 people are tested at each camp here daily. Anybody testing positive is immediately taken to makeshift quarantine centers, crucial for those where home isolation is not an option. The Delhi government has projected that the number of cases in the capital may rise up to 500,000 by the end of July. To handle such a caseload, some spacious venues in the city are also being converted into COVID care facilities. This ashram is being prepared to become one of the world's largest COVID care centers. Essentially an isolation facility, it has a capacity of 10,000 beds, most of which are made of prefabricated cardboard material. Once open, it will provide round-the-clock medical supervision for mild and moderate cases.
There is pressure on the general healthcare system. It is a new disease, one that we were not fully equipped to deal with when it began, and it became a pandemic, and we have to supplement the general healthcare system.
Even though lockdown restrictions have been eased to some extent in Delhi, there is still much confusion and anxiety amongst its residents. As the capital continues to formulate and implement new strategies, it has a tough task ahead of itself as the challenge of coronavirus has now turned into a crisis.
And let's get more. I am joined now by our correspondent in Delhi, Manira Chowdhury, who submitted that report for us. You looked at these measures taken by the government in order to contain the virus, yet we're seeing a spike in daily cases. Does it mean the measures have failed?
Well, one big reason that the spike in the number of cases is being attributed to is the relaxation in the lockdown rules. The life is returning back to normalcy. A lot of economic activities have resumed. Markets have opened up. And Delhi being a very densely populated city, this kind of transmission, when a lot of people do resume their daily work, is quite possible. But on another side of the story is also that after this became evident that Delhi is seeing a lot of cases, the testing increased. Now, Delhi is testing a lot more than a lot of other cities, which are still testing around 7,000 or 8,000 people per day. Delhi is now testing 20,000 about. So because of this increased testing, more and more cases are being detected now. So we are seeing a lot of numbers coming forward because of increased testing as well.
Are those tests easily accessible to everyone who needs them, who wants them?
Well, now the testing facilities have increased. You can go and get tested in hospitals and laboratories, but you do need to be sure about your symptoms. You do need a doctor's prescription, because at the moment, only high-risk category people and people who are showing certain symptoms are being encouraged to go and get tested. And in other containment areas, as we saw in my report, in informal settlements which are crowded, the government is organizing these regular testing camps where about 100 or 200 people are getting tested every day. And the tests being used are rapid antigen tests, which are showing results in about 15 to 20 minutes. So positive cases are quickly being either put in isolation in home or taken to quarantine centers.
Tell us a little bit more about those containment areas that you reported on for the infected. What is the state of social stigma surrounding that? Do people feel stigmatized? Do they feel comfortable going there?
Well, the definition of term containment zone has been tweaked a little in the past couple of months, but essentially means an area where cases have been detected. And it's for the government, it's important to demarcate these areas because to map local transmission and to even prevent local transmission. So movement is restricted, not those many activities are allowed as in other areas. And people do understand the importance of these zones. But people who do feel a little stigma are those, outside whose homes quarantine posters are being pasted, those who are coming out positive in COVID and who are being put under home isolation. So certain posters are being put outside their homes, which basically declare till what time they're supposed to be in quarantine. They feel a little stigma coming from there. But the government feels these posters are important because it gives them a sense of urgency and responsibility.
Munir Chowdhury in Delhi, thank you.